People say Canada has free healthcare, but no one tells you the real cost of it. It's not always money. Sometimes it's about time, sometimes it is also about pain that you go through, and sometimes it's the quiet fear that you will be forgotten in the hallway when you need the help the most. Let me tell you what happened. A few weeks ago, I took someone close to me to the emergency room. They were in absolute pain, the real visible pain, and we thought it's going to be quick because it's a strong issue, and we showed up around 5 p.m hoping we would be seen in a couple of hours. But nothing moved. It was already 9 o'clock and we hadn't reached the triage. And there was a baby crying in a stroller non-stop, a man holding his side clearly in agony, and an elderly woman trying to nap on a chair. And the waiting room felt less like a hospital and more like a place which is holding to suffer with pain. And the nurses, they were kind for sure. And also, I could see that exhaustion in their faces. And here, they were not the problem. They were also drowning in it. Eventually, I think it was around 2 o'clock or 3 o'clock, we were told that we wouldn't be seen that night because there are less doctors. There's only one doctor who has to see several other patients, and we may not be prioritized because there are too many critical cases. And they don't have enough staff to address all of those people waiting in the emergency room. We should either try to get into a walk-in clinic the next day or come over in the morning to see somebody else. So we couldn't wait any longer and we walked out without anything, absolutely nothing. No treatment, no tests, no answers also. Just that helpless, hollow feeling. And that's exactly when it hit me. Canada's healthcare system is not broken because of one bad doctor or one understaffed hospital. It's broken because the whole system is under pressure from every angle that you can imagine. Let's talk about why this is happening particularly in Canada, which is known as one of the top destinations for a lot of immigrants here. The first reason is, of course, Canada's population is aging fast. By 2030, 1 in 4 Canadians will be over 65 years. This is not an unknown fact. It got ignored totally because older population naturally need more care, more tests, more hospital time, and of course, more medications. Blame whoever you want. The system was not designed to handle this much demand all at once, and especially after COVID. And there is an absolute healthcare worker shortage here. That's an known fact, open secret. And thousands of doctors and nurses are either retiring or they are absolutely burning out because of all of this which is happening. And as per the 2023 report, which was released by the Canadian Medical Association, and that showed over 60% of healthcare workers are going through a burnout. And many are leaving the profession altogether. And I've seen those kind of news all around several times. And you can't run a full system with half the people working in those hospitals, right? And third top reason is the lack of family doctors. And it's estimated that over 6.5 million Canadians don't have family doctors. And I've been living in Canada for 4 years. I don't even know who the family doctor is. I don't even have that hope I'm going to get one soon. And that means more people show up at the walk-in clinics or either the emergency rooms when they don't have anyone to look after. Even for the things that could have been handled earlier because they have nowhere else to go. And in these cases, the emergency room becomes the only option to go and to be seen by somebody else. But that also cannot handle the crowd. Fourth biggest issue, slow licensing for international medical professionals. Canada tries to attract, brings in doctors and nurses from all other countries, but most of them can't practice right away. They're either stuck in long certification process or they have to go through the examinations or some sort of paperwork. Even though they are trained and saved hundreds of thousands of people's lives back in their countries and absolutely qualified and willing, they have to sit on the sidelines. And meantime, what happens? Hospitals run short staff. It makes no sense to me at all. And healthcare is managed by each province, and each province has their own regulations and processes. And if you are in New Brunswick or Nova Scotia like me, you might wait longer than someone in Ontario or Alberta or British Columbia for that matter. Because your local system may have fewer hospitals because of less funding or fewer specialists that are available in that particular province. And when there's a budget cut or staffing crisis, it hits fail to attract people from other provinces. Harder on the smaller province because it's absolutely because of the compensation or whatever reasons. So yes, healthcare is absolutely free here, no doubt about it. But what you save in money, you might lose in time or urgency. And if you are a newcomer, that promise of universal care can feel like a bit of a myth for most of us, especially when you have waited hours only to be told, we can't see you tonight. But here's what I want you to remember. This isn't about blaming the nurses. They absolutely have nothing to do with it. And it's also not about saying Canada is a bad place to live. It's about acknowledging the gap between the promise and the reality, because that's the only way change ever starts. And that night in the emergency room changed something in me. And not just because of the long wait, but because I saw a system full of good people trying to do a good job with not enough resources, not enough help, and not enough time. So the next time someone says Canada offers free healthcare, take a pause and ask them back at what cost.